Hey everybody, Dr. Patel here. Hope you all are doing well. Thank you for joining me for my Facebook Live this week. We've been talking about a lot of different things over the last year or two, and we've gone over a lot of different topics, from different musculoskeletal injuries to different treatment types. And even at times we've been talking about the field of regenerative medicine that I'm practicing in, and specifically treating orthopedic conditions with orthobiologics or regenerative medicine. And one of the things that we've discussed in the past are these concept of stem cells. But there is a lot of information and misinformation about what stem cells are and what can be done, what the science actually shows. Fortunately, unfortunately, there's also a lot of hype that's associated with stem cells, and today I'm going to be talking a little bit about that. If you want to go through any of our previous talks, if you want to talk about, if you want to hear my talks about various conditions, including most recently ligament injuries, hypermobility, arthritis, various different things, you can see all of our prior videos on my Facebook page. Or on our website, fxregencenter.com. If you have any things that you want to specifically see me or hear me talk about, then please comment, DM, or email us at info@fxregencenter.com. And if you enjoy this talk or any of my other talks, then please subscribe, like, and share these videos so everybody could see all the wonderful things that I'm talking about. Anyway. Without further ado, I want to talk about a specific thing that has come up over the course of the last couple of weeks. And, you know, I've had a few patients ask me and talk to me about Tony Robbins and the book that he came out with called Life Force. Tony Robbins, if you don't know, is a prolific author and motivational speaker, inspirational presence in the world over the course of the last decade or so. He's a strategist for businesses, a strategist for life, and has been a big part of the movement of life coaching that has taken place over the course of the last decade or so as well. And overall, he's really on the cutting edge with a lot of things, including, to a certain extent, science. And he himself has reportedly had some injuries and issues that he's dealt with in various different ways. And one of the treatments that he had really sparked supposedly this interest in new and promising medical technologies and medical science that he ended up kind of putting together in this book called Life Force. Now, the co-authors of the book are physicians, and I don't know any of them personally, but really, obviously, the big driving force of this book is Tony Robbins himself. But obviously, Tony Robbins is not a clinician, a physician, or a scientist, but he is somebody that is very, very good at getting people excited, and that is both a positive and a negative when it comes to this book and some of the interviews that he's been having on various channels. So, what is he talking about, and what's good, what's bad, what's the truth, what's not? I wanted to kind of visit some of the topics that are that he talks about. First and foremost, there's some things I have not finished reading the book. I've read excerpts of it at this juncture, and I've seen some of his interviews, and there's actually a great summary of some things by colleagues of mine, including Chris Santano from Regenix, posted a great blog on this just this last week or something along those lines. But from what I understand, there's actually some really interesting things that Tony Robbins discusses. And he interviews a lot of clinicians, physicians, researchers from across the world, and there's some really interesting and exciting and promising sciences that he talks about And really the world as we know it has a lot of exciting things that are being researched. That being said, there's a lot of stuff that is being researched all the time, and really only a small fraction of these things end up coming into fruition as far as actually providing benefit to people. And that's the point of research, right? That's the research that we do to make sure that things are beneficial. First of all, things are safe, and then that things are beneficial for the various conditions that they are treating. I'm speaking very, very vaguely here because the reality is that the book Life Force talks about a variety of different things, ranging from anti-aging all the way to regenerative medicine and orthopedics. So the world of anti-aging has exploded, and there's a lot of really cool and interesting research that's being done on those fronts. But there is a lot of hype, and there are a lot of false claims, or really not even necessarily false claims, but premature claims that are being made about various different treatments and modalities that may or may not be beneficial for anti-aging. So I'll give you an example of that. Is that there is a decent amount of growing animal literature and a very, very little tiny bit of human literature in support of a few different supplements in the anti-aging arena, including things like resveratrol, quercetin, and fisetin, that potentially have some benefit not only for anti-inflammatory purposes, but also in cell senescence and in allowing us to age more appropriately in general. There are some interesting podcasts. I'll link to that in the comments later. That I think are worth listening to. That show that some of these things might actually have some pretty good promise. But on the other hand, there's not a substantial amount of human research, nor will there ever be, because it's very challenging to do human research when it comes to lifespan. But when we think about treatments like resveratrol, which is one of the ingredients that's found in red wine, there has been some research that supports that as an anti-inflammatory and potentially in the slowing down of the aging process, and there's not much harm that seems to be associated with it. So these type of things might be perfectly reasonable things to try on ourselves. Because the benefit to risk ratio is actually skewed towards the benefit. If there is benefit, great. If there's not, no harm done. But there are other things in the anti-aging world that we have to be a little bit careful about. So there are people that are doing IV treatments of various different substances, and that we may not know what benefit can or cannot come from it. One of these substances that has gained popularity across the world, and to a certain extent in the US, has been the use of IV stem cells. Now, I use stem cells as a quote because there are folks that have been doing IV stem cells in the US that, depending on the product that's used, may or may not actually contain stem cells. For example, there are a bunch of companies that have created umbilical and amniotic and placental products many of which have been studied by third-party researchers and found to have little to no actual living stem cells in those products. Then there's other substances such as what are called exosomes, which are the products of cells in our body. And there's a bunch of exosome products that are available on the market at this juncture. And really, with those exosome products and these umbilical and placental and whatever cord blood products that are available in the U.S., technically the FDA has actually said these are illegal because they have not gone through the appropriate research measures to show that they're safe, let alone efficacious. But there are a lot of clinics nationwide Although the FDA is starting to crack down on this, there are still a lot of clinics nationwide that are taking these substances and injecting it IV to then treat the whole body and have an anti-aging effect, or to treat, somebody's diabetes or their Alzheimer's or their XYZ, etc. A lot of these clinics are saying that they're going to be treating everything under the sun with these products. And the reality is that, again, there's not any human research evidence of safety, any robust evidence of safety, let alone efficacy for any number one of these treatment or these conditions. So there's those products that have been kind of going through the U.S. and people have been taking advantage of the little science that there is that shows promise. There's a little bit of science that shows promise purely in animal models and in the research setting, but then these companies have taken advantage of that little bit of research and are making these claims, and these products are now being injected into people's IVs with God knows what long-term outcomes. This is really a scary and important thing to consider because a lot of the cutting-edge medicine world has developed to really prey on patients that are desperate. Maybe you have a condition that has no specific treatment options. Maybe you've tried multiple treatments for your conditions that have failed. Maybe you have a diagnosis such as cancer that is really ultimately going to end your life, and you're looking for something that may give you a modicum of hope, a chance to actually improve whatever is going on. Now, on one hand, there are some promising technologies that may actually be able to provide that hope, but on the other hand, unfortunately, there are a lot of bad players, bad actors that are taking advantage of your desperation and selling treatments that really may not be providing any benefit at all and potentially can be harmful. Now, this not only is in the realm of anti-aging, but this is in the realm of treating multiple different kind of conditions, cardiac conditions, pulmonary conditions, and it's certainly in the orthopedic realm. In the orthopedic realm, with musculoskeletal injuries, with pain conditions, for a while everybody was selling something off the shelf to try to inject into you and heal your cartilage and regrow your joint. But the reality is that number one, these products that are off the shelf are not legal, like I said. And number two, we don't know how these may or may not help or potentially harm you. So, now, unfortunately, in Tony Robbins' genuine and altruistic enthusiasm, he's highlighted some of these potential benefits and drawn with that highlighting of the research and the stuff that's going on by making us aware of this in his interviews and in his book. He's actually hyping these type of treatments up, not as a potential treatment that may be beneficial in the future, but the way in which this stuff is, propagated is going to be taken advantage of by these bad actor players, by these bad companies and clinics throughout the nation that are going to take information like Tony Robbins' books and say, all right, see, Tony Robbins says that this stuff is a miracle. Well, we're offering it here for a low price of $20,000, right? So we got to understand that although a lot of the things that Tony Robbins is saying in his book and in his interviews are exciting and are promising, not all of these new and emerging sciences are actually going to come to fruition as safe and effective treatments. And just because it's something that is exciting right now does not mean that it's something that you should get done right now. So very, very important distinction to be made. So Tony Robbins specifically talks about how he's had injuries himself, a shoulder injury, a back injury, and that outside of the country, he ended up having this IV infusion of umbilical stem cells, and he reportedly immediately felt better the following day, or whatever, that week, and has been substantially cured since then. He talks about there's things that are on the horizon. There's people may be able to do a treatment that shaves off a decade off your life and heals everything in your body, regrows the tendons, regrows the cartilage. And if it sounds like science fiction, it's because it is. There is nothing on this earth that is as magical as that sounds. And as much as it sounds amazing to think about that, and as much as things like, Star Trek and Star Wars predict some interesting medical technologies, the reality is that right now, at this moment, there is nothing like that exists. And it would be pretty crazy, pretty wild for something like that to exist anytime in the near future. Now, there are things that can help your body heal. There are treatments that can promote your body's health. And there are things that patients themselves can do that can help with, anti-aging and with healing appropriately, right? Exercise, hydration, nutrition, anti-inflammatory nutrition, going more towards a plant-based diet. These are all things that can actually potentially slow down your aging, improve your well-being, improve your blood flow and your ability to heal, right? These are natural things that you can do right now that the research is showing could be beneficial, but at the very least is not harmful. And that's something that we need to really, really hone in on. One of the things that Tony Robbins did talk about that we also got to pump our brakes on is the timeline of recovery, and some of these false claims that a lot of companies are making with the products that they have is that we're going to do this shot. Not only is it going to heal the cartilage and regrow the cartilage in your joint, but also you're going to feel immediately better. So there's a few different things that can cause that level of improvement so rapidly. Number one is if the treatment provides some level of an anti-inflammatory effect. So whether this is a treatment that's injected into a joint or a treatment that's injected into the IV, if that causes some level of an anti-inflammatory effect, well, that might actually improve pain. You know what else does that? A steroid injection. So if you've ever had a knee injury or arthritis, and if you've ever had a steroid injection by your physician to help with that, then oftentimes the pain relief comes within anywhere between a few hours to a week or two. And typically it's within a few days that you start to feel some significant improvement. Well, that's because the cortisone or the steroid causes some anti-inflammatory effect. Other things that can cause rather immediate benefit are things like anesthetic solutions. So numbing solutions, like your lidocaine, can actually cause a decrease in symptoms. So the question then that we have to ask is not only is what is it that the person is injecting into the knee joint as far as stem cells are concerned, but also what else is included in the mixture that's being injected. I've actually heard of clinics that will inject your knee with umbilical stem cells from a product, claiming that they're going to regrow cartilage, claiming that they're going to improve the pain right away. And some of the stuff that's in there is actually lidocaine numbing solution and steroid. Well, that's fantastic. So the lidocaine is going to give you temporary relief for a few hours, and the steroid is going to kick in a day or two and cause you to have relief. And wow, all of a sudden you're feeling better. Have you actually regrown any cartilage? Well, actually, no. And for that matter, lidocaine and steroid actually have harmful effects for cartilage. So what kind of scam is being played, right? So we really, really have to take a step back. If something sounds too good to be true, it probably is. So that's one of the things. Those are some of the things that could potentially cause some short-term benefit immediately, or rather quickly. What else can cause rather quick benefit from these procedures? Well, it's certainly not the cartilage growing back right away. It's certainly not your joint regrowing right away. Because even if these stem cells were going to be alive and taking an effect, it takes some time for a biologic effect to take place. Your healing, let's say when you cut yourself, right? Your cut doesn't heal right away. We're not Wolverine where we just have a healing factor and immediately heal, right? It takes some time for healing to take place. And any kind of biologic procedure would take time too. So what's the other thing that can cause immediate benefit? Well, that's our good friend placebo. Placebo is an actual effect, is an actual biologic effect that takes place in which a treatment tricks the system into thinking there is benefit. Placebo is a really, really interesting thing, a really interesting thing, because placebo can occur even if you know a treatment is a sham. Placebo can occur not only immediately, but there's some literature that suggests that placebo, the effect of placebo, can last weeks to even a couple months. So placebo is actually a really strong biological effect that takes place. And if you think that you are going to heal, then you do get some transient benefit to your symptoms. So I have a comment here. Nick said, just for comparison between Tony's claims of rapid healing versus what you've seen is actually possible. When somebody gets a biologic procedure, he mentioned the Regenix SD intradiscal procedure, doesn't it take 6 weeks to 6 months to see benefit versus just a few days? This is exactly what I'm talking about. If I have a patient that comes to me and says, hey, you did the procedure on me yesterday, today I'm freaking feeling fantastic, I always say, that's great that you're feeling so good, but let's pump our brakes a little bit. I still expect some levels of ups and downs over the course of X amount of time, and I expect you actually to be back to your baseline pre-procedure level of pain in a couple weeks. Because you're actually going to have, when we do a biologic treatment using a patient's own PRP or bone marrow or adipose fat tissue, there is some level of an inflammatory effect that takes place, because inflammation is actually the first part of healing. So there are these pro-inflammatory and anti-inflammatory effects that are taking place that go on for the first couple weeks. Then after you're back to your baseline pre-procedure level of pain, then you gradually start to have improvement. And that's not a linear path. That's, one of these type of things where you're gradually having ebbs and flows in a positive trajectory. And Nick, you're right. It could take anywhere between 1 to 2 months to start feeling benefit, 2 to 3 months to really feel benefit. The majority of benefit typically takes place within the first 6 months, but even 6 months to a year. And we've seen in our data that even beyond a year, people have an upwards trajectory in terms of their improvement. So this is not a quick fix. This is not a lidocaine anesthetic injection. This is not a cortisone injection. If we're actually trying to create biological change, that takes time. That's a really, really important concept that we got to wrap our heads around. Now, there are some treatments that could provide quicker relief. Even things like some biologic treatments like A2M or alpha-2 macroglobulin, which is a strong anti-inflammatory protein. There are some other treatments that can potentially soothe the joint or the area that is being injected. So there are things that could provide sooner relief. I've even had some patients that have instability. Going back to the last couple of weeks' topics, talking about instability and ligament injuries, I've had some patients that had neck instability from whiplash or hypermobility, EDS, things along those lines. When I injected into their joints, the sheer presence of the fluid provided some temporary stability. And that actual inflammation that was being caused actually felt good because it was providing some stability to those joints that were loose. Great. But as the fluid gets absorbed, that actually settles down, right? And then gradually over time, as the biologic is taking effect, as the ligaments get stronger, as the environment gets healthier, then that's when the effect starts taking place. So this takes time. So some of the things that Tony Robbins talks about, hey, I got an IV and I felt immediately better for X amount of time. Well, you better believe that his rotator cuff is not healing. You better believe that the arthritis and the stenosis in the low back has not disappeared. So this is a really, really important thing to consider. Really, really important thing to consider. And for that reason, Tony Robbins is definitely not watching this right now, but maybe, just maybe, because I tagged you, Tony Robbins' staff or people or whatever might see this and say, hey, maybe this is something we got to look into a little bit more, because I implore you, Mr. Robbins, to get a repeat MRI of your shoulder and get a repeat MRI of your low back, and let's do a before and after comparison. Because even then, it's just one case, right? We can't make any definitive claims off of one case, but I would love to see if that rotator cuff has healed completely. I would love to see that the stenosis and the arthritis and the disc issues, etc., have healed completely in the low back, because if it has, and if we can reproduce that in multiple humans, then that is something that truly, truly is exciting. Well, that's really all I got. We can dig deeper into these topics some more, but you can see how I feel about the excitement, the medicine, the developments, and really the true promise that's there with some of these technologies. But we also have to take a step back, right? We also have to get a reality check. If anything sounds too good to be true, it probably is. We got to look at the science. The science is not perfect. The science is growing, but we got to look at what is being learned with every step of the way. And on one hand, while it is exciting, and it's okay to get excited about the medical technologies that are in our future, we can't jump on that and think that this is the cure, the miracle. And we got to be careful when somebody as prolific as Tony Robbins comes out with a book called Life Force that almost sounds holy in its promise. The stuff that we're doing isn't magic. It's science. And it's exciting, but we got to be careful. Hope you all enjoyed this talk. If you have any other questions, concerns, comments, please comment. Email us at info@fxregencenter.com. If you want to talk about your particular situation, you can email us or call us at 310-929-9790. And find this video and more on our Facebook page and on our website, fxregencenter.com. I wish you guys have a very, very happy Friday and a great weekend. Wishing you all the best, and I will see you next week.